There are certain types of medications where using the special instructions field is particularly important. Information included here can alert providers and pharmacy staff of important information. These include tapering or titrating doses, range doses, short-term medications, held meds, and medications the patient has not started yet. Let's cover each one of these briefly, starting with med tapers and titrating doses. Select the desired drug name from the search options. In the dose field, do not enter in an amount. Instead, type in "See instructions" and then enter the dose amount in the Special Instructions section. Include the tapering or titrating instructions here as well. Be sure to enter in the start date in this section. If a patient is taking a medication with a dosing range, such as a pain medication, start by searching for the desired drug name as usual. For this example, we will add Percocet 5-325. The patient can take 1 to 2 tabs every 4 to 6 hours. When documenting the dose and frequency, chart the highest allowed amount per dose and the shortest time interval for frequency. So for our example, we would chart 2 tabs in the dose and then Q4 hours in the frequency. In the special instructions, chart the full dosing instructions. Of note, if the patient is on more than one pain medication, include the level of pain the patient takes the medication for, such as for moderate or high levels of pain, in the special instructions as well. Next, we will cover short-term medications. It is important to note that the duration, start, and stop dates will not cross over for the pharmacist to see if the physician decides to continue medications. This is especially important for medications that are to be used for a specified time frame, such as antibiotics. To enter in a medication that has a specified duration, start by entering in the name of the medication in the search field. Again, select the medication from the options available. If the patient knows the strength of the antibiotic, you may enter the amount in the dose field. If not, enter in "See instructions," then type in the details in the free text box. Remember to include when the patient started the antibiotic. You are also to use the special instructions section when charting held meds. Document the medication as you normally would. However, in the special instructions section, enter in the date the medication has been held since and the reason it was placed on hold. Be sure to update the compliance status to "Not Taking." For medications the patient has been prescribed but has not yet started, enter in the drug as you normally would. In the special instructions, indicate that the patient has not started their medication and give the reason if possible. Again, be sure to update the compliance to "Not Taking." It is best to avoid using medical terms and unapproved abbreviations when entering in details, as this information will print out on the patient's discharge instructions if the physician resumes the medication when they go home. A list of unapproved abbreviations is included in Learning Live and may also be found in the Resources tab if viewing this video in a training module. Although there are too many medications to cover in these videos, there are a few that need to be discussed. We will cover this next in the video Special Medications.